briefly, I just want to take a look at the literature and talk about what it says, because there is a small but growing literature about the psychological experiences of living with a rare disease. And what's in there is both fascinating and, in my mind, common sense that's really nice to see in data. Common sense, I think we're gonna, there's a lot of things that we're gonna relate to as Gaucher patients. And so in this article, they were looking for, in the participants' own words, adults living with rare diseases. This is in the US. What were the most prevalent experiences or challenges that rare disease patients faced? And so they listed the symptoms specific to their disease, any limitations that disease imposed on activities, issues related to treatment method, treatment side effects, uncertainty. I know we saw that in our first question answers today, and issues with caregiver support. The article concluded that some things that would help people living with rare diseases with these issues would be improved medical care, especially that focused on how to reduce activity limitations. And this is one of the fascinating things that the research showed to me, which is this idea of how big a factor the healthcare and the healthcare system that we're dealing with is on rare disease patients' well-being. So we're going to see this come up multiple times. Increased awareness around their disease would be helpful, social support, and greater access to information. In this study, we see again the healthcare issue come up. So they specifically asked people, how important is the fact that your disease is rare in terms of the difficulties that you experience, as opposed to any other aspect of it, just the rare portion. And what was so interesting about this small study was that it was a clarification. The responses were that the rarity of one's disease was not identified as a cause of unique difficulties unless they felt like their healthcare had failed them in some way, their system, their interactions with doctors, their lack of diagnosis, their misdiagnoses, the way they were treated by doctors, all the things that I know that many of us have experienced. And if that was going on, then being rare was identified as a cause of unique difficulty. So I personally found that to be really interesting and true in my experience. This study also identified some key issues in being a rare disease patient that were specific to being rare versus having a more common chronic illness. So delayed diagnoses and misdiagnoses, healthcare experiences such as health professionals that refused to seek more information when it was clear that they were not knowledgeable, poor diagnosis disclosure, so not doing so in a way with a good bedside manner, with the right information, sometimes minimizing the seriousness of the diagnosis for some reason or another. Patients identified that as rare disease patients, they really wanted more information about how to be active. You remember that from the first study that I showed there very quickly, how to be more active, and information that would help them live rather than identify all their limitations. Insufficient treatments, as I think most of us on this call know, very few rare diseases actually have a treatment, and not all of those treatments are good treatments. And come with a lot of issues in and of themselves. And isolation, I know I heard that pop up in the first slide, the first question as well. As rare disease patients, isolation is one of the main psychosocial issues that we deal with. The isolation of not just the physical implications of the illness, but the fact that we may not, before the advent of the internet especially, really talk to or get to engage with or meet in person other people that understand our specific experiences or healthcare professionals that can help us. And so the conclusion of this study was that the participants expressed a strong desire to feel morally well treated as a patient, and that this was more important than some of the specific issues of their specific rare disease that they dealt with. And again, feel free to jump in at any time with comments or questions. This is a different study that wanted to identify some key areas about having a rare disease and what was connected to our mental state. And again, the number one factor identified here was healthcare problems, misdiagnosis, not being diagnosed, delayed diagnosis, inability to find the right specialists and the right care. Any social or economic issues also were identified as big factors here in mental distress and having a rare disease. Impaired family conditions, either prior to diagnosis or exacerbated by chronic illness. Dwindling friendships and leisure activities, impairments in partnership and sexuality, and elevated mental vulnerability. And the conclusion in this study was that the psychological impact of having a rare disease increases when health, social, and economic problems further complicate existing personal and relationship problems. So if we already have some existing relationship and partnership problems, these economic and financial and social and health-related issues that come up as a rare disease patient are probably going to be worse because we already had what they're calling psychological vulnerability going into the situation. And so we all know that living with a rare disease is black and white, and that the zebra has become our symbol. But as I, have lived this experience, and as I also now treat other, people living with chronic illness and rare disease, I really feel like a lot of the experience is very gray, and a lot of the issues that are dealt with are very ambiguous and uncertain. So whether or not we'll find the right diagnosis, being believed for symptoms, finding appropriate medical care. The question, how are you, is very complicated when you have a rare disease. We have no idea sometimes how we're going to feel later today or tomorrow, next week, next year. It might be a difficult question to answer. It can be very gray to try to explain your lived experience to a healthcare professional who may or may not understand whether or not there's a treatment. It can be very uncertain if anybody's going to be able to spell or pronounce or try to spell or pronounce your disease. I know we hear Gaucher and all kinds of interesting ways to say Gaucher. Obviously, those people never took French. So we get lots of interesting things there. Insurance issues, family issues, if the disease is genetic, there's uncertainty about whether or not it'll be passed on through our family line. And sometimes it's uncertain and gray if we're going to survive or if our loved one is going to survive if we're a caregiver. I want to continue to pause to leave space for comments and questions as I go. An additional stressor can be the fact that as rare disease patients or parents or caregivers, we are often the experts, and we are often the ones that have to educate the medical professionals. And so there's a role switch, a role imbalance in the healthcare relationship that we may not be comfortable with, and certainly many medical professionals are not comfortable with. And that is something that physicians have to understand when they have patients with rare diseases, that they may not be the authority in the room. And we are, especially in the Gaucher community, we are very knowledgeable and very passionate, and we do not take no for an answer. And they might not be comfortable dealing with that, and we might have to grow our comfortability with being in that role. Um, so generally speaking, what is different in the psychological and emotional experience of zebras? Um, and so looking at these studies and some other studies that were not included in here today, we do see that in rare disease patients, there is an increased risk for depression and anxiety, more so than with somebody who has another illness that is more common. Okay, so there's an increased risk for depression and anxiety in people with chronic medical illness, but there is an even greater increased risk for rare disease patients because of some of the issues that we've mentioned. There is also a whole talk to be had, not today, but about the fact that there can be trauma symptoms associated with being diagnosed with an illness, living with an illness, encountering the healthcare system, being hospitalized, being in ICU. These situations can create trauma. And I do see a lot of my patients that have what I would call subclinical post-traumatic stress disorder. There is no official diagnosis for it, but it's a lot of symptoms like hypervigilance of bodily sensations. For example, when somebody has PTSD from a traumatic event, they might be hypervigilant about similar circumstances that remind them of the traumatic event. In medical patients, we might see this, for example, with chronic pain, hypervigilant of physical sensations, or somebody had a traumatic experience in the hospital, right? They might be hypervigilant in that in a similar circumstance as well. Again, we see the increased risk for social isolation and stigma because when people don't understand what you have, which is usually the case with a rare disease, stigma tends to follow. And as mentioned, significant sources of our stress are often not related to the illness. They are related to everything else that comes with having an illness. Financial obstacles, dealing with the medical system, very expensive treatments, dealing with health insurance. In fact, I would say that sometimes as much as half or more of our distress in living with a rare disease comes from non-illness related issues. If we could actually deal with our illness and pain without all of these other issues that we have to deal with, it wouldn't be fun, but it would sure be a lot easier. I know that because we're coming from all around the world today, we're all encountering different healthcare systems. So I'm actually curious if anybody has any thoughts or comments on this, because in the United States, we have this managed care system where, and private insurance and all of that, and it's a full-time job managing everything that comes along with that, going to receiving care and figuring out the financial aspects of that. I don't want this to be a doom and gloom presentation either. And I think it's important to note that there's some positive experiences that rare disease patients have because of everything that we're talking about, having to be our own advocates, having to do our own research, having to navigate all this uncertainty. There's also increased resilience, perseverance, grit, whatever you want to call it. In my world, we call this post-traumatic growth. And so we talked about trauma, right? And PTSD, mentioned that. The flip side of PTSD is PTG, post-traumatic growth, which is looking at how do people sometimes feel like they've grown after traumatic experiences. And I feel like that is often the people that I know in our community, right? People that have grown from their rare disease experience. We're often, by necessity, more adaptable. Hopefully, eventually, we come to a place of having more self-compassion and more self-esteem because we know how much we've overcome to get where we are and take care of ourselves. And hopefully, we also get to a place where we're able to find meaning in what we have gone through and what we're still going through. and incorporate that meaning into our life story and into our life's mission even. Being strong and resilient is kind of a full-time job in this gig. And sometimes we all just need a break. And part of the coping strategies of dealing with all of this is recognizing when we've hit our limits, right? And learning to feel comfortable saying no where we can and setting boundaries and asking for that support when we need it, right? That is a skill. It is a skill that sometimes we need to learn and be comfortable with, especially if we, are typically very independent or like to take care of ourselves, don't like to be dependent on others. It can be a difficult line to navigate. It would also be nice too if people just offered out of the blue, but well, that's neither here nor there. So just to sum up, some of the different areas that get impacted psychosocially are our emotions, families and social relationships. There is an impact of the financial situations and how that affects us. Any effects on our abilities to work or pursue or continue education, leisure time, sexuality, intimacy, and body image. These are often issues that come up in the course of exacerbations of illness or changes that have occurred because of illness or medications, and role changes. These role changes might mean that in our family, if we are a parent, we may not be able to equally share the responsibilities with our partner, and that can affect the roles that we have together as parents and partners. Sometimes we have adult children living at home, and the roles that would normally exist between an adult child and a parent are different because the adult child is sick and needs to be taken care of. So we have another question. And the question is, I can see it. Which area or areas do you feel have been negatively impacted by living with a rare disease? And here are some of the choices that I just mentioned. Psychological, emotional health, family, social relationships, leisure time, financial security, education, work, sexuality, intimacy, body image, role changes. One thing I want to mention here is this idea of ambiguous loss. Grief is a process that we deal with when having a rare disease, but it's a little bit different than the loss of another person, because with chronic illness and the exacerbation and remissions that we experience, we might experience grief that continues, comes and goes on a regular basis, and doesn't necessarily have more of a typical winding down point that you have after the loss of a person, because it keeps being triggered and we keep being reminded of those losses in different situations. And so when we look at ambiguous loss versus traditional loss, we talk about the idea that it's difficult to mourn because the loss is less defined. The losses are sometimes harder to pinpoint for ourselves. There's not any customary rituals in grieving a chronic illness as there is in grieving a person, right? We have funerals, we have wakes, we have gatherings. There's things that we do to mark the loss of a person. We don't really have any ceremonies or concrete ways to mark the losses that we might experience day to day living with a rare disease. We might experience a low tolerance to ambiguity from ourselves, our friends, families, and coworkers, right? It's very ambiguous. Sometimes having to explain to people how we feel, when we feel, what we feel, why we look okay when we actually feel terrible. It can be very ambiguous for our loved ones to understand. And oftentimes this loss of living with chronic illness, and certainly rare disease, is just not recognized or understood by society. And so it can feel like a lonely type of loss. Okay, so as promised, here is my COVID-19 slide. And just, I think maybe a month ago, there was a really wonderful study released by a few different rare disease organizations around the world called Making the Seen Unseen, Rare Disease Lessons Learned from the COVID-19 Pandemic. And they had three conclusions about how did the COVID-19 pandemic affect the rare disease world, some of which some of you have already talked about a little bit. There were delays in diagnosis, partly because people were a little bit reluctant to go to the doctors they needed to because of concerns of contamination and catching COVID. There was a reduction in referrals and requests for investigations that are pretty important in many rare disease diagnoses were also decreased during this time as well. The COVID-19 pandemic exacerbated some of the already existing issues that we have talked about today in accessing healthcare for rare disease patients. In this study that was done, very large study, they found that 83% of people living with rare disease experienced delays or cancellations in diagnostic testing, treatments, surgeries, films, and appointments. I can tell you that I'm one of those people. When we went into the pandemic, I was already a couple months overdue to see my specialist here in Chicago. And then by the time I did see him, I was almost a year overdue for my annual visit and tests. I still haven't gotten the tests, they're scheduled. Fortunately, I've been fairly stable for a long time. So, if that was not the case, I would have done something different, but it was really difficult to try to make it work. It sounds like other people have experienced this as well. We were shut down in the beginning as well for many months to any kind of visits except emergencies. But even when it began opening back up, I know many people were reluctant. And I also know of patients and families here in the US. I'm thinking of a friend in particular, a mom with a young son with Gaucher disease, who was receiving home infusions for him for many years. And that was another nightmare to figure out because she did not want anybody coming into their home. A nurse coming into the home, and unless they were willing to basically be deloused and sanitized from head to toe on the way in the door, right? And she had issues with the nurses who couldn't or wouldn't fulfill those safety concerns for her. So she had to choose between getting her son his treatment that time or forgoing it because they didn't feel safe letting a particular person in their home. I'm trying to locate a nurse that they could trust during this past year to understand that he also has some other issues besides Gaucher disease. If he were to get sick, he was in the high risk category. He would have been in a very bad spot. So that's also been an interesting scenario this year. And as somebody mentioned before, I believe it was Paulina, there were breakdowns in the rare disease drug development process, in reallocating resources from, physicians' normal responsibilities to COVID responsibilities. And as rare disease patients, when there's only one doctor in your country, or there's only one doctor, within a short flight from you, and in our case, in a different state, perhaps, if they're not available, nobody's available. And that's particularly scary and stressful. So real quick, I want to just go to this last section here and ask this last question. I'm curious what has helped you manage some of these stresses this year, either due to your rare disease or the pandemic or the combination of the two. And I will say that, social connection in general is one of the most important coping strategies when we have chronic illness, but especially when it's rare. Again, because as we know, we may really have to work hard to get those connections for people that really understand. So when I was asking Paulina that question earlier about which kind of support, there's support and then there's peer support, right? So we need both kinds of social support. As rare disease patients, we need general support, but we also need to feel connected to people who get us, who understand specifically what we're going through. It's really important to try to have both. And that really helps with that isolation and feelings of loneliness, and which can impact our mood or make us anxious. So, understanding that there's more than one kind of support out there. And also what I'm seeing in some of these answers is, these coping strategies are in different categories. Some are more passive, like distraction, right? Netflix would be one of my go-to ones as well, right? And some are more active, where we're engaging in an activity that requires all of our attention rather than points it away from the thing that's stressing us out, right? Passive or active coping strategies. And both are good and both are helpful. Generally speaking, the more actively we're coping, either through activity or problem solving or helping other people, whatever that is, those tend to help our mood and well-being a little bit more than the passive coping techniques, although both have their place. So if it's okay, I'm just going to share just a little bit more, and then I think that's all I got. Oops. Nope. That's not the one I wanted. That's the one I wanted. Okay. So here we go. So as a health psychologist, when I'm working with somebody that has a chronic illness, a chronic medical illness, we're looking at a few different types of coping strategies here. We're looking at how to cope with illness from the perspective of our thoughts, a cognitive type of coping strategy. So this might mean really noticing our negative self-talk. If we're engaging in any unhelpful thought patterns, like going to the worst case scenario or thinking in black and white terms and not being able to kind of see that there might be options in between those black and white terms, and illness beliefs, which is on the next slide. I'll talk about that in a second. And what I'm doing here is I'm talking about coping strategies that in my world, in working with patients, when everything feels out of our control, which is often the case in the rare disease experience, what are the things that are within my ability to empower myself to do, right? From a psychological perspective. So we've talked a lot about the systemic influences on our mood, and we may or may not be able to impact those, but we may be able to increase our distress when we're encountering those situations, right? We don't want to invalidate that reality that we're experiencing, but we do want to try to reduce the distress around those experiences. So I'm going to go to this slide here. Some of those negative thought patterns are specific to illness. So we call these, I don't like this word maladaptive. We're going to call this unhelpful views of illness. Okay. So some folks, when they get sick or they live with sickness, consciously or unconsciously view being sick as some sort of punishment, right? They might feel like they've done something wrong, something to deserve this. We all have wondered at some point, did I bring this on myself, right? Am I causing this in some way? It's a pretty common but unhelpful thought pattern that's really helpful for us to be aware of. Sometimes there's a religious aspect to this, and there may be a concept of sin that comes up, that I must have done something, I must have sinned in some way. Unhelpful thought patterns of illness might include feeling hopeless, right? hopeless about our body, our status, our ability to control our circumstances, feelings of betrayal by our body, by our physicians, our healthcare teams, sometimes even by family and friends. And I have to keep moving this, I'm sorry. Preoccupations with changes in our self, our physical self, and preoccupations with kind of what is sometimes called a sick role. We can all fall into this role where our illness seems to define us in ways that are not empowering, and it can become difficult to get out of those views. And so I want to clarify here that I've done all of these almost every week of my life as a rare disease patient. So these are not things that are uniquely terrible things that somebody might do. This is something we all do. It's pretty common, and it can be helpful to notice it. Just want to go back here really quick. So we talked about cognitive, talk about behavioral coping strategies. My number one here, I always start with behavioral strategies for sleep. I can't emphasize enough that if you are not sleeping well, if you are not falling asleep well, if you are waking multiple times in the night, if you are waking up earlier than you need to, and you are not getting enough and restful sleep, that is the place to start. Because if you can regulate your sleep, if you can figure out how to treat your sleep issues, that will impact your mood, and it will impact your physical health. So there's always something to look out there if that's an issue. In the interest of time, I'm just going to go to the next slide. So these are also some health-related beliefs that I just want to mention here. Sometimes when we have an illness, we can feel like everything is externally controlled. So we want to try to be aware of, do I feel like I have any control in the situation, or what is it that I feel like I can control in the situation? We want to try to have as much of an internal sense of control over our health-related issues as possible. Health-related self-efficacy is how we feel we are able, our confidence in ourselves to handle the demands of our illness and treatments. And sense of coherence goes back to that idea of meaning that we mentioned a few slides ago. The more that we can find a way to make sense of our illness and our diagnosis and what we're experiencing and fit it into the story of our life, the more likely we are to have less depression and anxiety. And I'm going to leave it at there. And we talked about support. These are all the various ways, and not all of the ways, that we can try to access some of that peer support that we talked about that's so important, either with other patients or within the medical profession. I do want to do a little plug here for health psychology and just let you know that if you are looking for therapy of some sort, therapeutic support, there are many wonderful psychologists out there, but you should know that there are psychologists that specialize in working with people with medical issues, and they're called health psychologists. So if you are going to talk to somebody specifically about living with medical illness, you should know that you can find somebody who has a lot of experience in just that area, and that is available to you.